Hey, you guys, Dr. Nicole here. Today, going to talk to you about something that no one really likes to talk about that much, but I'm going to talk to you about it anyways, and it is constipation. All right. I know there's a varying degrees of what people deem being constipated as, and so I'm going to give you the classic definition, and you're going to sort of self-evaluate and see if you happen to be in that constipated category. Now, and we're going to talk a little bit about why too, and how your pelvic floor and your pelvic PT can be involved in helping your constipation go away. So pooping is really important. It helps us to eliminate all the waste and icky things out of our body. And so when we get backed up or we don't poop regularly, all of those icky things are staying in our bodies for too long. And then the longer it stays in there, the more water is taken out of the fecal matter, and the harder the harder it gets to pass. And so constipation, just by definition, there can be a lot of different reasons for it, but by definition, it's based on what's normal bowel movement frequency. And there's actually a pretty wide range. So normal for somebody could be as little as 3 times a day, and as little as 3 times a week, and as many as 3 times a day. And that's all still within the normal range. So what I always want people to assess is what is normal for you. Before you had insert whatever issue, if it's constipation itself, great. If it was pelvic pain or something else, then say before that, if you can remember, like what time did you normally go? Did you normally go once a day? Most people kind of have an idea as to what their normal is. So if you are normally going once every day, right, then you can still be considered constipated if you're going still technically within the normal range of 3 times a week. Conversely, right, if you are you're going, 3 times a week, and then you all of a sudden go 3 times in a day, something's funky with your bowels, right? So if you're going 3 times a day normally, which you're still in the normal range, and which is like maybe a lot of people do that after every single meal, and all of a sudden you maybe go once a day, maybe skip a day, that's pretty significantly constipated for you. So make sure you are assessing what your normal is, and you can still be considered constipated even if you're outside the range of normal. There's also something called a Bristol stool scale, which is kind of, frankly, a little bit gross, but we got to talk about it. So it's what type of poop do you have? So this is understanding your bowel movements. There's type 1, which are basically like little pellets. Type 2, 3, 4, which is basically like a long sausage. Type 5, 6, and then type 7 is a little bit more liquidy. So what we want, and what is considered normal, is that every single time you go, it is in that type 3 and type 4 sort of on that scale. So that's, and if it's not, right, so you can be going every day technically, but if it's in that type 1 where it's real pellety and hard or painful, that can still be considered constipated. So it's taking into consideration the quality and the quantity of your pooping. So that's number 1. Number 2, there's a lot of different things, but there's 2 major ways that we can be constipated. We can either have low motility, meaning your intestines, which are moving fecal matter through your intestines and pulling out nutrients, going through your large intestine, that can be slower than normal. Sluggish for things like inflammation, if you're not drinking enough water, if you're not getting enough movement, and a lot of medications can actually slow down motility. And ironically, if you're in pelvic pain, a lot of pain medications actually slow down your motility and cause anything that causes dry mouth usually also slows down the motility of your bowel system and your intestines. So that's number 1. Number 2 is that you can have something called outlet constipation, which is the actual pelvic floor muscles. When you sit down and poop, these guys have to relax and open the door here for poop to come out. And especially there's a muscle around here that's in this sort of horseshoe shape called your puborectalis that actually unkinks, when it relaxes, it unkinks the rectum. So the rectum is a straight shoot versus at a curve. So your pelvic floor at the same time, right? Your motility has done its job. It's gotten it all the way down to where your sigmoid colon is. It gets another little thing that where it's like, yikes, you feel like you have to go. You go and you sit on the toilet, and then magic happens, right? Then your colon and your rectum start to push stuff through. That's involuntary. And then you have a relaxation of your pelvic floor, and hopefully everything goes out all at the same time, and then goes back to its normal state and waits to fill up again. So that's what sort of normal is. And when that's disrupted, either in the motility part where it's slower going through your colon, which means a lot of times more water and nutrients are getting pulled out of it, which makes it harder, like actually literally harder stools, or your pelvic floor is having a difficult time relaxing. So right, you can have good normal motility and then your pelvic floor won't let it out, or you can have really sluggish motility and your pelvic floor is relaxing, but it's not giving you the oomph to get out. Or those things are actually working okay, they're just not coordinated at the right time. So pelvic floor physical therapists can help with any one of those options of an issue. And we can also assess to see what is actually the problem. And the way that we do this is that we give you a good external evaluation first. We talk a lot about your nutrition and things that you're putting in your body, because that can affect greatly the motility issue of your colon. And then we also talk about the pelvic floor piece on how well you're able to actually relax these pelvic floor muscles at the correct time. And so in that way, pelvic floor physical therapists are probably one of the best equipped practitioners to help you if you are suffering from constipation, either as a primary issue or as a secondary issue to another problem, especially one in the pelvis. So we actually did a study at our clinic and found that actually bowel complaints are not usually the primary reason we're actually seeing people, which we hope that changes at some point. But they are almost, I think it's up to 80% of our patients on a questionnaire will actually report one or more symptoms of a bowel dysfunction, like we just talked about, either bowel urgency or constipation or incomplete feelings of incomplete emptying or painful bowel movements or any one of those other things. And so it can greatly influence pelvic pain. It can influence how your nerves are functioning there. And then it can also influence how your pelvic floor is working if that's a constant source of aggravation of your pelvic floor. So please, please, please don't be embarrassed, and make sure to tell your pelvic floor physical therapist if you're having any bowel issues, because we need to know those kinds of things if you haven't been asked about them. Secondly, if you're having issues with that, we're the kind of people that would love to help you to poop better. So please get to a pelvic floor physical therapist to help with any sort of bowel issue you might have, but including constipation. And remember, your physician might not know that a pelvic floor physical therapist is actually trained extensively in the function of the pelvic floor muscles and of the colon from a functional standpoint. They do a great job of doing all of the other motility tests and everything else. But a lot of times, if you're clear on those, or their intervention is simply medications, we can actually look at it from a functional standpoint and make big changes with just a small amount of visits. So come and see a pelvic floor physical therapist if you're suffering from any sort of constipation at all. Thanks.